Type 1. Low pelvic incidence and a sacral slope under 35 degrees. The lumbar lordosis is short with the apex low at L5. These spines have a long thoracolumbar kyphosis and limited ability to compensate. Type 2, also low pelvic incidence but with the apex slightly higher, around L4. The overall curvature is flat, producing the so-called flat back morphology. These individuals often experience early disc degeneration due to a lack of normal lordosis. Type 3 corresponds to a moderate pelvic incidence between 45 and 60 degrees. It represents the balanced spine, where the curves of the pelvis, lumbar spine, and thorax are in harmony. Within type 3, there are two subtypes. Type 3, NP, the normal pelvis subtype, has a pelvic incidence between 50 and 60 degrees and a sacral slope of 35 to 45 degrees. The apex level is centered around the L4 vertebrae. The trunk is well centered over the pelvis, and the alignment is biomechanically efficient, what is deemed the most common and physiologic morphology. Type 3, AP, the anteverted pelvis subtype. Here, the pelvis tilts forward in relation to the femoral heads, producing a slightly deeper lumbar lordosis and a more anterior trunk alignment. This subtype has a lower pelvic incidence between 40 and 50 degrees with a similar sacral slope of 35 to 45 degrees. The apex remains at L4. This configuration can increase shear stress at L5 to S1. Furthermore, the deeper lumbar lordosis produces more stress on the posterior elements, leading to earlier degeneration. The lower pelvic incidence additionally complicates the situation, since it comes with a more limited capacity to compensate through retroversion. Finally, type 4 represents a high pelvic incidence, greater than 60 degrees, and a sacral slope above 45 degrees. The lordosis is deep with an apex extending up to L3, while the thoracic kyphosis is shorter. These spines have a strong compensatory potential, allowing greater pelvic rotation, but at the cost of increased stress on the lumbosacral junction.